After 40 years of service, the pediatric dental clinic at the Norfolk Health Department's Little Creek location will close September 30th. Many health department-based dental clinics across the state are closing as public health changes over to mostly school-based preventive dental services. So what are the alternatives? The Hampton Roads Community Health Center is one of them and provides services to both children and adults. Please welcome CEO Barbara Willis, Chief Dental Officer Dr. Robin Langston, and Administrative Director Ginger Melton. So thank you very much for coming to share what it is you do with the community health centers in the region. I know that medical and dental care are provided. We're focusing on dental, but we'd love to hear a little bit more about what your organization does as a whole.
Well, thank you for having us today, Jan.
My pleasure.
We're greatly appreciative of the opportunity to share with you about the services that we offer as one of the key safety nets in our community. Hampton Roads Community Health Center, as a matter of fact, is celebrating its 20th anniversary on September 22nd at the Women's Club in Portsmouth, Virginia.
Oh, okay, great.
So we invite you all to come out for that exciting event. But we're here today to talk about dental and what opportunities are available to individuals in the community as a result of the dental clinic on Little Creek closing. And we're pleased to share with you that we at Hampton Roads Community Health Center are providing dental care to children as well as adults. Dr. Robin Langston, who is our Chief Dental Officer, can share with you in terms of the services that we provide. And then also we can, one of the things that we are able to do for you is to provide services conveniently located to where the Little Creek office is currently housed, and that's at our Ocean View Medical and Dental Center that's located at 9581 Shore Drive, right next door to Mona Lisa's Pizza, for those who are familiar with
There
the
you
area.
go. Nothing like a local reference and landmark in order to be able to find something. Great, okay, that's very helpful. Yes, people do need to know that because sometimes transportation can be an issue too, so you don't want to have to be running all around town.
Yeah.
So the services that are provided through the dental clinic are more than just a screening or a check.
Yes. The services that we offer are exam, x-rays, cleanings, fillings, dentures, partials, and complete dentures. We also offer crowns, bridges, also education, as well as, let's see, tender loving care too.
Okay, tender loving care is very important when it comes to dental work, because not everybody loves going to the dentist.
Exactly. And we also have a 40-foot mobile van, and we just purchased another one.
Really?
Yes. So we visit the schools around the area. We visit Suffolk, Portsmouth, and Norfolk.
Wow.
Yes.
So two 40-foot mobile vans that are cruising around, and you do the work in the vans?
Yes, we do all the work in the van, and also not only do we go to the schools, but we also visit the CSB, which is on Virginia Beach Boulevard.
That's the Community Services Board, for folks who don't know that.
So we see adults there and provide all services for adults on the van. And what we can't do on the van, we refer them to our East Ocean View office.
Okay.
You know, for follow-up care.
You stay pretty busy?
Yes.
Yeah?
Yes.
I imagine you do.
So we usually see anywhere from about 15 to 20 patients a day.
All right. Now that's a good number. And as far as the people who come to these locations that offer the dental care, there's one in Portsmouth also that offers dental services. This requires, is there certain qualification?
Yes, usually they have to bring proof of income, a picture ID, and the proof of income can vary from their award letter, their last pay stub, or if they're unemployed, a W-6 from the unemployment office. And generally, if they bring that information in, we can determine where they fall on our sliding scale if they don't have any type of dental insurance, and they pay a nominal fee to be seen for services.
What about Medicaid? Do you accept that?
Medicaid offers full service, full coverage for children, and also as of March 1st, they offer full service for pregnant women. So we'd really like to get that word out that if you're pregnant and you have Medicaid, you can actually take advantage of full dental services through Medicaid, no charge at all to the patient. For adults on Medicaid, the coverage is limited. They can get a comprehensive exam, x-rays, and extractions. So they basically cover emergency services. But thankfully what we've seen that because Medicaid pays for that exam, we do have some people that come back and take advantage of their treatment plan by using our nominal fee.
Okay, great. So they're exposed to the fact that there are other things they can do.
Yes.
And oral health is just so important.
Yes.
It is.
So very important and often overlooked.
And we like to get them when they're young,
Yes.
so that they can have a pleasant experience and they want to come to the dentist. So we also have free dental services for children on our mobile van.
Okay.
So the children who do not have dental insurance, they're not turned away. We still provide dental services for them as well.
Great. What do you find to be the most common issue with children in terms of dental problems?
I would say dental caries.
Okay, so it's something that
Yes.
they might be able to control is what I mean.
Exactly,
Yes.
yes. And a lot of times, you know, the parents think that they shouldn't eat candy. And not that I'm encouraging them to eat candy, but my thing, if you're going to do it, then you need to brush more
Yeah.
to prevent the dental caries.
And of course, I guess, how you brush your teeth is important too. Do kids ever get a chance to demonstrate just how they do it?
Yeah, and you know, that's a great opportunity with the school dental program. We saw over 1,000 children on the mobile dental unit in the school systems last year. So that was 1,000 opportunities to teach oral health education. So hopefully that will have a great impact on what we're trying to do to improve oral health in our community.
Well, great, and it's a great start because that's where it all begins, in childhood and
That's
being
right.
shown the right way to do things, because if you don't know,
Yes.
you don't do it.
Exactly.
Yeah. Or you have bad role models, which, you know, can make a big difference.
But you know, I find a lot of parents who have had, well, I shouldn't say a bad experience, but they have a lot of cavities, missing teeth. I see them bringing their kids in to change that behavior, which is awesome.
Yes, that's great because they know they don't want their children to go through this.
Exactly.
I did want to take a moment too, if you don't mind. We've had put the number up for people to call and check about the dental appointments and
Yes.
information. Also, just wanted to mention that Old Dominion has a School of Hygiene that also provides not treatment, but they will do some screenings and such. But that's for adults. And so the number up there on the screen, they should be getting underway just about now. Usually they run from September to June. But if you just need to have your teeth looked at, fine, but they're not going to do any kind of an exam per se like a dentist, because these are all hygiene students, but it is an option. However, if you have kids and you have some issues yourself, community health centers can certainly give you the information you need, so give them a call. And find out, particularly since you've got a shore drive location.
Yes.
That's nice and close, or at least reasonably close. It's on the same road, essentially.
Exactly.
Yes.
Pretty much. Just go down Little Creek Road, you'll get there, right?
Yes, and we have a relationship with the ODU School of Hygiene.
That doesn't surprise me.
Right, yes, we do it all. They come through and rotate through our centers.
Great.
And and they refer patients to us as well.
Okay, great. Thank you so much.
Yes.
Great information. Hopefully somebody can benefit even more so than they already are by giving you a call. Thank you for taking the time to be here.
Well, thank you.
When we return, a daytime caregiving center expands its services and its facility and moves to Norfolk.